evaluation, client needs, health promotion and maintenance, cognitive level, synthesis 66. 1. This is appropriate once the dose has been adjusted for a neonate. 2. This is appropriate once the dose has been adjusted for a neonate. Answers 360. Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam 3. At 2 weeks old there probably will not be a level yet. 4. Digoxin can be administered to neonates but this is an adult dose. The neonate maintenance dose is 4 to 8 mcg/kg, 0.125 mg equals 125 mcg. The dose for a 6.82 kg infant would be 27 to 54 mcg per day. Content: Pediatric, Category of Health Alteration, Drug Administration, Integrated Processes, Nursing Process, Implementation, Client Needs, Physiological Integrity, Pharmacological and Parenteral Therapies, Cognitive Level, Application 67. 1. The infant's arm does not have enough tissue for an injection. 2. The infant has a poorly developed dorsogluteal muscle and the sciatic nerve is in this area of the body. Injecting a needle into the nerve could cause permanent damage. 3. Vaccines are not administered into the abdomen. 4. The anterior lateral thigh muscle, vastus lateralis, is the preferred site for an infant to receive an injection. It is the largest muscle the infant has and is far away from nerves. Content: Pediatric, Category of Health Alteration, Drug Administration, Integrated Processes, Nursing Process, Implementation, Client Needs, Physiological Integrity, Pharmacological and Parenteral Therapies, Cognitive Level, Comprehension 68. Answer: 45 ml per hour. The 4 pump is set at an hourly rate. Pediatric clients receive medications at the rate per hour prescribed by the healthcare provider. Increasing the rate to a higher rate is not within the realm of nursing judgment. The medication should be administered at the rate determined by the healthcare provider to be a safe volume. Content: Pediatric, Category of Health Alteration, Drug Administration, Integrated Processes, Nursing Process, Implementation, Client Needs, Physiological Integrity, Pharmacological and Parenteral Therapies, Cognitive Level, Application 69. 1, 3, and 5 are correct. 1. This child has injuries consistent with child abuse. Child Protective Services and the police should be notified. 2. This could result in not being able to prosecute the perpetrator if the nurse is not trained in forensic medicine. 3. The nurse should determine the full extent of the child's injuries. 4. The nurse should not notify the parent of the potential involvement. The police are fully capable of doing this for themselves. The nurse could instigate an inflammatory situation with this action. 5. The child needs X-ray studies to determine the extent of internal injuries. Content: Pediatric, Category of Health Alteration, Integumentary, Integrated Processes, Nursing Process, Implementation, Client Needs, Safe and Effective Care Environment, Safety and Infection Control, Cognitive Level, Application 70. Correct answer: 5, 3, 2, 4, 1, 5. Taking the vital signs is part of the assessment and a beginning point for the nurse. 3. Since the child has been losing fluids, the nurse should assess tissue turgor to try and determine whether fluid replacement by the parents has been effective. 2. The nurse should make sure that the parents do not leave the child alone in the room and make sure the parents are aware of any safety measures used to protect the toddler from abduction and how to call the nurse in case of need. 4. The parents will need to change diapers so the child will not develop skin irritation problems. 1. When the nurse provides diapers, it is a good opportunity to teach the parents about weighing the diapers before and after the child soils them. Content: Pediatric, Category of Health Alteration, Gastrointestinal, Integrated Processes, Nursing Process, Implementation, Client Needs, Physiological Integrity, Reduction of Risk Potential, Cognitive Level, Analysis Chapter 12 Pediatric Health Management 361 Scenario Answers Clinical Scenario Answers and Rationales. The correct answer number and rationale for why it is the correct answer are given in boldface type. Rationales for why the other possible answer options are incorrect also are given, but they are not in boldface type. 1. The child who is having respiratory difficulty, inspiratory retractions, should be assessed first. Remember Maslow's hierarchy of needs. 2. A pulse oximeter reading of 93% is within normal limits, 93%, 100%. It is on the low side because CF is chronic hypoxia and a low arterial oxygen level is expected. 3. This is a normal potassium level, therefore, the nurse would not assess this child first. 4. A 210 mg/dl glucose level for a child with type 2 diabetes is not life-threatening, and the nurse would not assess this child first. 2.1. The child in a sickle cell crisis is not stable, therefore, Ms. Laura should not delegate this task to a UAP. 2. Oxygen is considered a medication and MS. Laura cannot delegate medication administration to a UAP. 3. The child with nephrotic syndrome experiences weight gain secondary to edema, which is expected with this disease process. This child is stable, and the UAP can obtain weights, therefore, Ms. Laura can delegate this task to the UAP. 4. The child with a TBI is not stable, therefore, the UAP should not transfer this client to the ICU. 3.1. Immobilizing the child's leg is appropriate for Mr. Aaron, therefore, this would not warrant intervention by Ms. Laura. 2. Mr. Aaron should explain the procedure to the 2-year-old using age-appropriate terms, therefore, this would not warrant intervention by Ms. Laura. 3. The needle and syringe should be disposed of in the sharps container, therefore, this action does not warrant intervention. 4. Mr. Aaron should not recap the needle after administering the medication, so this warrants intervention by Ms. Laura. The syringe and needle should be disposed of in the sharps container. 4.1. Ms. Diane, the UAP, can document intake and output, and the child has a chronic illness. Therefore, the child is stable. This task could be delegated safely. 2. The child with an acute exacerbation of IBD must be NPO, therefore, this task should not be delegated to Ms. Diane. This cannot be delegated by Ms. Ruth. 3. Ms. Diane can elevate this child's leg and it is appropriate to elevate the leg to help decrease edema. This task could be delegated safely. 4. Ms. Diane can take laboratory specimens to the laboratory. 5.1. Ms. Laura should suspect this child has otitis media and would not have to assign MS. Poly to this child. A less experienced emergency department nurse could care for this client. 2. Ms. Laura should suspect this child is experiencing an acute exacerbation of reactive airway disease and assign Ms. Poly to this child. This child is in a potentially life-threatening situation. 3. Ms. Laura should suspect this child has a urinary tract infection, which is not a life-threatening situation. Ms. Laura should think about possible sexual abuse, but the most experienced nurse would not need to care for this child. 4. Ms. Laura should suspect the child has pneumonia, which is not a life-threatening situation, therefore, the most experienced nurse does not need to be assigned to this child. 6.1. The child's temperature should be reduced by receiving an antipyretic medication such as Tylenol, but it is not the first intervention Ms. Laura should implement. 2. Ms. Laura should suspect bacterial meningitis and place the child in isolation until definitive diagnosis is made. Ms. Laura must protect the child but also all the other clients, visitors, and staff in the emergency department. This intervention must be implemented first. 3. The child will need to receive a lumbar puncture for definitive diagnosis of bacterial meningitis, but it is not the first intervention. Protecting others from this very contagious disease by placing the child in isolation is the priority. 4. Notifying the infection control nurse is an important intervention, but not priority over protecting other individuals in the emergency department. 362 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam 7. 1. The mother should call 911 so that immediate medical treatment can be given to the child. 2. This is an appropriate question to ask to determine appropriate treatment, but the first thing RN should do is to have direct contact with poison control to determine the medical treatment for the child. 3. Syrup of ipecac is no longer recommended because vomiting may cause more damage to the child, or lead to aspiration pneumonia. 4. Contacting poison control is the first intervention. Poison control will be able to provide Mr. RN with the correct instructions to give to the mother to help dilute this poison and remove it from the daughter's body. 8.1. The object should not be removed until surgery. Removing the object can cause more damage and possible hemorrhaging. 2. The child's medical history and allergies should be determined, but it is not Ms. Laura's first intervention. 3. Ms. Laura should first stabilize the pencil in place so further damage will not take place. The left eye should be patched to prevent eye movement. If the uninjured eye moves, the injured eye will also move involuntarily, possibly causing more damage. 4. The child's vital signs and pulse oximeter reading should be assessed but not prior to stabilizing the injury. 9.1. The best response on the Glasgow Coma scale is 15, so a score of 12 indicates neurological deterioration and requires notifying the neurologist first. Mr. RN cannot implement any independent nursing interventions to help the child. 2. RN should document the findings in the chart, but first should notify the neurologist since this indicates a deteriorating condition. To select this option, the data in the stem must be expected or normal for the client. 3. RN should continue to assess the client's Glasgow Coma scale, but not prior to notifying the neurologist. 4. Placing the child in the high Fowler's position will not help increased intracranial pressure, therefore, Mr. RN should not implement this intervention. 10.1. Ms. Laura should suspect acute epiglottis, which is a potential medical emergency and should not be assigned to an inexperienced nurse. 2. Ms. Laura should suspect this child will be having emergency abdominal surgery and should not assign the child to an inexperienced nurse. 3. This child is stable and will need an X-ray, therefore, an inexperienced nurse could care for this client. 4. Ms. Laura should realize this child may be hospitalized and should assign this child to a more experienced nurse. 11.1. The child is stable and Ms. Michelle can escort the child to the car. This task can be delegated by Ms. Ruth. 2. This is assessment and Ms. Ruth cannot delegate assessment, teaching, evaluation, medications, or an unstable client to a UAP. 3. This is teaching and Ms. Ruth cannot delegate teaching. 4. The UAP may be able to assist the HCP with this task, but of the 4 options the test taker should select the least invasive, or the task that will require the least amount of nursing knowledge. 363 13 Be nice to people on your way up because you meet them on your way down. Jimmy Durante 1. The nurse in the outpatient psychiatric unit is returning phone calls. Which client should the psychiatric nurse call first? 1. The female client diagnosed with histrionic personality disorder who needs to talk to the nurse about something very important. 2. The male client diagnosed with schizophrenia who is hearing voices telling him to hurt his mother. 3. The male client diagnosed with major depression whose wife called and said he was talking about killing himself. 4. The client diagnosed with bipolar disorder who is manic and has not slept for the last 2 days. 2. The nurse is caring for children in a psychiatric unit. Which client requires immediate intervention by the psychiatric nurse? 1. The 10-year-old child diagnosed with oppositional defiant disorder who refuses to follow the directions of the mental health worker, MHW. 2. The 5-year-old child diagnosed with pervasive developmental disorder who refuses to talk to the nurse and will not make eye contact. 3. The 7-year-old child diagnosed with conduct disorder who is throwing furniture against the wall in the day room. 4. The 8-year-old mentally retarded child who is sitting on the playground and eating dirt and sand. 3. The male client diagnosed with major depression is returning to the psychiatric unit from a weekend pass with his family. Which intervention should the nurse implement first? 1. Ask the wife for her opinion of how the visit went. 2. Determine whether the client took his medication. 3. Ask the client for his opinion of how the visit went. 4. Check the client for sharps or dangerous objects. 4. The client on the psychiatric unit is yelling at other clients, throwing furniture, and threatening the staff members. The charge nurse determines the client is at imminent risk for harming the staff/clients and instructs the staff to place the client in seclusion. Which intervention should the charge nurse implement first? 1. Document the client's behavior in the nurse's notes. 2. Instruct the MHWs to clean up the day room area. 3. Obtain a restraint/seclusion order from the HCP. 4. Ensure that none of the other clients were injured. Questions. Mental health management. 5. A woman comes to the emergency department, ED, and tells the triage nurse she was raped by 2 men. The woman is crying and disheveled, and has bruises on her face. Which action should the triage nurse implement first? 1. Ask the client whether she wants the police department notified. 2. Notify a sexual assault nurse examiner, SANE, to see the client. 3. Request an ED nurse to take the client to a room and assess for injuries. 4. Assist the client to complete the emergency department admission form. 6. The nurse is working in an outpatient mental health clinic and returning phone calls. Which client should the psychiatric nurse call first? 1. The client diagnosed with agoraphobia who is calling to cancel the clinic appointment. 2. The client diagnosed with a somatoform disorder who has numbness in both legs. 3. The client diagnosed with hypochondriasis who is afraid she may have breast cancer. 4. The client diagnosed with post-traumatic stress disorder, PTSD, who is threatening his wife. 7. The psychiatric nurse is working in an outpatient mental health clinic. Which client should the nurse intervene with first? 1. The client who had a baby 2 months ago and who is sitting alone and looks dejected. 2. The client whose wife just died and who wants to go to heaven to be with her. 3. The client whose mother brought her to the clinic because the mother thinks the client is anorexic. 4. The client who is rocking compulsively back and forth in a chair by the window. 8. The emergency department nurse is assessing a female client who has a laceration on the forehead and a black eye. The nurse asks the man who is with the client to please leave the room. The man refuses to leave the room. Which action should the nurse take first? 1. Tell the man the client needs to go to the X-ray department. 2. Notify hospital security and have the man removed from the room. 3. Explain that the man must leave the room while the nurse checks the client. 4. Give the client a brochure with information about a woman's shelter. 9. The charge nurse received laboratory data for clients in the psychiatric unit. Which client data warrants notifying the psychiatric health care provider? 1. The client on lithium, escalith, whose serum lithium level is 1.0 milliequivalent/L. 2. The client on clozapine, clozaril, whose white blood cell count is 13,000. 3. The client on alprazolam, Xanax, whose potassium level is 3.7 milliequivalent/L. 4. The client on quishapine, Seroquel, whose glucose level is 128 mg/dl. 10. The client diagnosed with a panic attack disorder in the busy day room of a psychiatric unit becomes anxious, starts to hyperventilate and tremble, and is diaphoretic. Which intervention should the nurse implement first? 1. Administer the benzodiazepine alprazolam, Xanax. 2. Discuss what caused the client to have a panic attack. 3. Escort the client from the day room to a quiet area. 4. Instruct the unlicensed assistive personnel, UAP, to take the client's vital signs. 11. The client diagnosed with a somatization disorder is complaining of vomiting, having diarrhea, and having a fever. Which intervention should the nurse implement first? 1. Assess the client's anxiety level on a scale of 1 to 10. 2. Check the client's vital signs. 3. Discuss problem-solving techniques. 4. Notify the client's healthcare provider. 12. Which nursing intervention is priority for the client diagnosed with anorexia who is admitted to an inpatient psychiatric unit? 1. Obtain the client's weight. 2. Assess the client's laboratory values. 3. Discuss family issues and health concerns. 4. Teach the client about selective serotonin reuptake inhibitors. 364 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam 13. Which client should the psychiatric clinic nurse assess first? 1. The client with long-term alcoholism who wants to stop drinking. 2. The client who is a cocaine abuser who is having chest discomfort. 3. The client with obsessive-compulsive disorder who won't quit washing his hands. 4. The client who thinks she was given the date rape drug and was raped last night. 14. The client diagnosed with schizophrenia is being seen by the psychiatric clinic nurse for the initial visit. Which intervention should the nurse implement first? 1. Develop a trusting nurse/client relationship. 2. Determine the client's knowledge of medication. 3. Assess the client's support systems. 4. Allow the client to vent their feelings. 15. The client diagnosed with hypochondriasis is angry and yells at the psychiatric clinic nurse, "No one believes I am sick. Not my family, not my doctor, and not you." Which statement is the nurse's best response? 1. Have you discussed your feelings with your family? 2. I am sure your doctor believes you are sick. 3. I can see you are upset. Sit down and let's talk. 4. We cannot find any physiological reason for your illness. 16. The clinical manager assigned the psychiatric nurse a client diagnosed with major depression who attempted suicide and is being discharged tomorrow. Which discharge instruction by the psychiatric nurse would warrant intervention by the clinical manager? 1. The nurse provides the client with phone numbers to call if needing assistance. 2. The nurse makes the client a follow-up appointment in the psychiatric clinic. 3. The nurse gives the client a prescription for a 1-month supply of antidepressants. 4. The nurse tells the client not to take any over-the-counter medications. 17. The charge nurse is caring for clients in an acute care psychiatric unit. Which client would be most appropriate for the charge nurse to assign to the licensed practical nurse, LPN? 1. The client diagnosed with dementia who is confused and disoriented. 2. The client diagnosed with schizophrenia who is experiencing tardive dyskinesia. 3. The client diagnosed with bipolar disorder who has a lithium level of 2.0 milliequivalent/L. 4. The client diagnosed with chronic alcoholism who is experiencing delirium tremens. 18. Which task would be inappropriate for the psychiatric charge nurse to delegate to the mental health worker, MHW? 1. Instruct the MHW to escort the client to the multidisciplinary team meeting. 2. Ask the MHW to stay in the day room and watch the clients. 3. Tell the MHW to take care of the client on a 1-to-1 suicide watch. 4. Request the MHW to draw blood for a serum carbamazepine, Tegretol, level 19. The male client in the psychiatric unit asks the MHW to mail a letter to his family for him. Which action would warrant intervention by the psychiatric nurse? 1. The MHW tells the client to place the letter in the mailbox. 2. The MHW informs the client he cannot send mail to his family. 3. The MHW takes the letter and places it in the unit mailbox. 4. The MHW reports the client mailed a letter at the team meeting. 20. The male client admitted to the medical unit after a motor vehicle accident, MVA, admits using heroin. The unlicensed assistive personnel, UAP, tells the nurse the client is really agitated and anxious, and has slurred speech. Which intervention should the nurse implement first? 1. Assess the client for heroin withdrawal. 2. Ask the UAP to take the client's vital signs. 3. Notify the client's healthcare provider. 4. Administer chlordiazepoxide, Librium, an anti-anxiety medication. Chapter 13 Mental Health Management 365 Questions 21. Which task would be most appropriate for the psychiatric nurse to delegate to the mental health worker, MHW? 1. Request the MHW to take the client with lithium toxicity to the emergency room. 2. Have the MHW sit with a client diagnosed with bulimia for 1 hour after the meal. 3. Encourage the MHW to teach the client how to express his or her anger in a positive way. 4. Ask the MHW to sit with the client while the client talks to his mother on the telephone. 22. The psychiatric charge nurse is making shift assignments for the admission unit. The staff includes 1 registered nurse, RN, 2 licensed practical nurses, LPNs, 4 mental health workers, MHWs, and a unit secretary. Which task would be most appropriate to assign to the LPNs? 1. Update the client's individualized care plans. 2. Stay in the lobby area and watch the clients. 3. Administer routine medications to the clients. 4. Transcribe the admission orders for a client. 23. The mental health worker, MHW, has tried to calm down the client on the psychiatric unit who is angry and attempting to fight with another client. The nurse observes the MHW taking down the client to the floor. Which intervention should the nurse implement? 1. Assist the MHW with the takedown of the client. 2. Call the hospital security to come and assist the MHW. 3. Document the client takedown in the nurse's notes. 4. Remove the other clients from the day room area. 24. The mental health worker, MHW, reports to the psychiatric nurse that 2 clients were kissing each other while watching the movie in the lobby area. Which action should the nurse implement? 1. Tell the MHW to tell the clients not to kiss each other again. 2. Discuss the inappropriate behavior at the weekly team meeting. 3. Transfer 1 of the clients to another psychiatric unit. 4. Talk to the clients about kissing each other in the lobby area. 25. The nurse is caring for clients in the psychiatric unit. Which task would be most appropriate for the nurse to delegate to the mental health worker, MHW? 1. Instruct the MHW to walk with the client who is agitated and anxious. 2. Ask the MHW to clean up the floor where the client has urinated. 3. Tell the MHW to phone the HCP to obtain a PRN medication order. 4. Request the MHW to explain seizure precautions to another staff member. 26. Which behavior by the mental health worker, MHW, is an example of assault requiring immediate intervention by the psychiatric nurse? 1. The MHW injures a client who is forcibly being put in the quiet room. 2. The MHW refuses to let the client come into the day room until putting on socks. 3. The MHW escorts the client to the anger management class in another building. 4. The MHW threatened to forcibly remove the client who is refusing to get out of the bed. 27. The charge nurse has assigned a licensed practical nurse, LPN, to administer medications to the clients on an inpatient psychiatric unit. Which client should the LPN force to take the prescribed medications? 1. The client with bipolar disorder who has been declared incompetent in a court of law. 2. The client with major depression who voluntarily admitted herself to the unit. 3. The client with paranoid schizophrenia who was involuntarily admitted to the unit. 4. The client with a borderline personality who has legal charges pending in the court. 366 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam 28. Which client should the psychiatric charge nurse assign to the nurse from the surgical unit who was assigned to the psychiatric unit for the shift? 1. The client diagnosed with schizophrenia who is hallucinating and delusional. 2. The client with bipolar disorder who is manic and aggressive towards staff and clients. 3. The client who is diagnosed with chronic depression and will not talk to anyone. 4. The client with schizophrenia and an axis 2 antisocial personality. 29. The psychiatric nurse assigned the mental health worker, MHW, to stay with the client 1-to-1 due to high risk for suicide. Which behavior by the MHW warrants intervention by the nurse? 1. The MHW stays with the client while in the bathroom. 2. The MHW provides the client with plastic utensils for breakfast. 3. The MHW stays outside the room during the client's group therapy. 4. The MHW watches the client walking outside from the porch area. 30. Which statement by the mental health worker, MHW, warrants intervention by the psychiatric nurse? 1. I assisted the client with dressing and hygiene this morning. 2. I am going to the team meeting for the next hour. 3. I gave the client with heartburn some Maalox. 4. I am going to play cards with some clients in the day room. 31. The nurse on the substance abuse unit is administering medications. For which client would the nurse question administering the medication? 1. The client admitted for alcohol detoxification who is receiving lorazepam, Ativan, and has an apical pulse of 110. 2. The client admitted for heroin addiction who is receiving methadone, Methados, and has a respiratory rate of 22. 3. The client admitted for opioid withdrawal who is receiving clonidine, Catapres, and has a blood pressure, BP, of 88/60. 4. The client diagnosed with Wernicke-Korsakoff syndrome receiving intravenous thiamine, vitamin B1, who has an oral temperature of 96.8 degrees Fahrenheit. 32. The psychiatric nurse overhears a mental health worker, MHW, telling a client diagnosed with schizophrenia, "You cannot use the phone while you are here on the unit." Which action should the psychiatric nurse take? 1. Praise the MHW for providing correct information to the client. 2. Tell the MHW this is not correct information in front of the client. 3. Explain to the MHW that the client does not lose any rights. 4. Discuss this situation at the weekly multidisciplinary team meeting. 33. The client diagnosed with bipolar disorder is admitted to the psychiatric unit in an acute manic state. The nurse needs to complete the admission assessment, but the client is restless, very energetic, and agitated. Which intervention should the nurse implement? 1. In a very firm voice, ask the client to sit down. 2. Administer lithium, escalith, an anti-mania medication. 3. Ask questions while walking and pacing with the client. 4. Do not complete the admission assessment at this time. 34. The client in the psychiatric setting tells the nurse, "There were so many people at the team meeting, I am not sure what the psychiatric social worker is supposed to do for me." Which statement is the psychiatric nurse's best response? 1. The social worker evaluates the effectiveness of the client's medication. 2. This person provides activities that promote constructive use of leisure time. 3. The social worker will assist you in keeping your job or help you find a new one. 4. This person works with your family and community and makes referrals if needed. Chapter 13 Mental Health Management 367 Questions 35. The male client diagnosed with paranoid schizophrenia is yelling, talking to himself, and blocking the view of the television. The other clients in the day room are becoming angry. Which action should the nurse take first? 1. Obtain a restraint order from the HCP. 2. Escort the other clients from the day room. 3. Administer an intramuscular, IM, antipsychotic medication. 4. Approach the client calmly along with 2 mental health workers, MHWs. 36. A young child, Joey, was admitted to the pediatric unit with a fractured jaw, bruises, and multiple cigarette burns to the arms. The mother reported the father hurt the child. A man comes to the nurse's station saying, "I am Joey's father, can you tell me how he is doing?" Which statement is the nurse's best response? 1. Your son has a fractured jaw and some bruises, but he is doing fine. 2. I am sorry I cannot give you any information about your son. 3. You should go talk to your wife about your son's condition. 4. The social worker can discuss your son's condition with you. 37. During an interview, the female client tells the psychiatric nurse in a mental health clinic, "Sometimes I feel like life is not worth living. I am going to kill myself." Which interventions should the nurse implement? Select all that apply. 1. Make a no-suicide contract with the client. 2. Place the client on a one-to-one supervision. 3. Ask the client whether she has a plan. 4. Commit the client to the psychiatric unit. 5. Assess the client's support system. 38. The psychiatric nurse is caring for clients on a closed unit. Which client would warrant immediate intervention by the nurse? 1. The client who refuses to attend the anger management class. 2. The client who is requesting to go outside to smoke a cigarette. 3. The client who is nauseated and has vomited twice. 4. The client who has her menses and has abdominal cramping. 39. The clinical manager wants to reward the staff on the psychiatric unit for having no tardies or absences for 1 month. Which action would be most appropriate for the clinical manager? 1. Provide pizza, drinks, and dessert for all the shifts. 2. Post a thank you note on the board in the employee lounge. 3. Individually acknowledge this accomplishment with the staff. 4. Place official documentation in each staff's employee file. 40. The nurse is working in an outpatient psychiatric clinic. The male client tells the nurse, "I am going to kill my wife if she files for divorce. I know I can't live without her." Which action should the nurse implement? 1. Take no action because this is confidential information. 2. Document the statement in the client's nurse's notes. 3. Inform the client's psychiatric health care provider, HCP, of the comment. 4. Encourage the client to talk to his wife about the divorce. 41. Which interventions should the inpatient psychiatric nurse implement for the client experiencing sleepwalking? Select all that apply. 1. Encourage the client to exercise prior to going to bed. 2. Place the client on elopement precautions. 3. Instruct the client to drink decaffeinated beverages. 4. Place an alarm on the bed activated when client gets up. 5. Tell the MHW to be on a one-to-one watch during the night. 368. Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam 42. The nurse is discussing the grieving process with the client. Which stages are included in Kubler-Ross's stages of grief? Rank in the correct order. 1. Acceptance. 2. Bargaining. 3. Denial. 4. Anger. 5. Depression. 43. The nurse is in the middle/working phase of the nurse/client relationship. Which statement is a task in the orientation phase? 1. Identify the client's strengths and weaknesses. 2. Help the client identify problem-solving techniques. 3. Evaluate the client's experience while in the group. 4. Establish the rules for how the meetings will be conducted. 44. Which situation requires priority intervention on an inpatient psychiatric unit? 1. A client is threatening to throw the television at another client. 2. A male client wants to use the phone to call his spouse. 3. A client sitting in a chair is delusional and hallucinating. 4. A client has refused to eat anything for the last 2 days. 45. The client with long-term alcoholism asks the nurse, "How does Alcoholics Anonymous help me quit drinking?" Which statements are the nurse's best responses? Select all that apply. 1. A has sponsors whom you can contact if you want to take a drink. 2. A discusses medications used to help prevent drinking alcohol. 3. A is a support group of alcoholics who have successfully quit drinking. 4. A helps you realize the power you have over your addiction to alcohol. 5. A has professional guest speakers to address addictive personalities. 46. The client diagnosed with bipolar disorder and who is prescribed lithium, an anti-mania medication, is admitted to the psychiatric unit in an acute manic state. Which intervention should the nurse implement first? 1. Have the laboratory draw a stat serum lithium level. 2. Evaluate what behavior prompted the psychiatric admission. 3. Assess and treat the client's physiological needs. 4. Administer a stat dose of lithium to the client. 47. The psychiatric unit staff is upset about the new female charge nurse who just sits in her office all day. One of the staff members informs the clinical manager about the situation. Which statement by the clinical manager indicates a laissez-faire leadership style? 1. I will schedule a meeting to discuss the concerns of the charge nurse. 2. I hired the new charge nurse and she is doing what I told her to do. 3. You and the staff really should take care of this situation on your own. 4. I will talk to the charge nurse about your concerns and get back to you. 48. The mental health worker, MHW, reports that one of the nurses threatened to force-feed the male client diagnosed with schizophrenia if the client did not eat the meal on the lunch tray. Which action should the charge nurse take first? 1. Tell the MHW that this intervention is part of the client's care plan. 2. Request the nurse to come to the office and discuss the MHW's allegation. 3. Ask the client what happened between him and the nurse during lunch. 4. Ask the MHW to write down the situation to submit to the head nurse. Chapter 13 Mental Health Management 369 Questions 49. The client diagnosed with paranoid schizophrenia is imminently aggressive and is dangerous to himself, the other clients, and the psychiatric staff members. The client is placed in a seclusion room. Which interventions should the psychiatric nurse implement? Select all that apply. 1. Assess the client every 2 hours for side effects of medication. 2. Tell the client what behavior will prompt the release from seclusion. 3. Do not notify the client's family of the initiation of seclusion. 4. Explain that the client will be in the seclusion room for 24 hours. 5. Instruct the MHW to check the client every 10 to 15 minutes. 50. The psychiatric nurse overhears a mental health worker, MHW, arguing with a client diagnosed with paranoid schizophrenia. Which action should the nurse implement? 1. Ask the MHW to go to the nurse's station. 2. Tell the MHW to quit arguing with the client. 3. Notify the clinical manager of the psychiatric unit. 4. Report this behavior to the Client Abuse Committee. 51. Which client should the psychiatric nurse working in a mental health clinic refer to the psychiatric social worker? 1. The client who was raped and wants help to be able to get on with her life. 2. The client who is scheduled for the first electroconvulsive therapy treatment. 3. The client who reports having difficulty going to work every day. 4. The client who is unable to buy the prescribed antipsychotic medications. 52. The psychiatric nurse has taken 15 minutes extra for the lunch break 2 times in the last week. Which action should the female clinical manager implement? 1. Take no action and continue to watch the nurse's behavior. 2. Document the behavior in writing and place in the nurse's file. 3. Tell the nurse to check in and out with her when taking lunch. 4. Talk to the nurse informally about taking 45 minutes for lunch. 53. The client diagnosed with Alzheimer's disease is on a special unit for clients with cognitive disorders. Which assessment data would warrant immediate intervention by the psychiatric nurse? 1. The client does not know his or her name, date, or place. 2. The client is unable to dress himself or herself without assistance. 3. The client is difficult to arouse from sleep. 4. The client needs assistance when eating a meal. 54. The mother of a client recently diagnosed with schizophrenia says to the nurse, "I was afraid of my son. Will he be all right?" Which response by the psychiatric nurse supports the ethical principle of veracity? 1. I can see your fear, you are concerned your son will not be all right. 2. If your son takes medication, the symptoms can be controlled. 3. Why were you afraid of your son? Did you think he would hurt you? 4. Schizophrenia is a mental illness and your son will not be alright. 55. The nurse is caring for clients in an outpatient psychiatric clinic. Which client would the nurse discuss with the healthcare provider? 1. The client diagnosed with bipolar disorder who is receiving carbamazepine, Tegretol, an anticonvulsant. 2. The client diagnosed with schizophrenia who reports taking the antacid Maalox daily for heartburn. 3. The client diagnosed with major depression who is receiving isoniazid, INH, an antituberculosis medication. 4. The client diagnosed with anorexia nervosa who is receiving amitriptyline, Elaval, a tricyclic antidepressant. 370. Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam 56. The client in the psychiatric unit tells the nurse, someone just put a bomb under the couch in the lobby. Which action should the nurse implement first? 1. Look under the couch for a bomb. 2. Implement the bomb scare protocol. 3. Have the staff evacuate the unit. 4. Tell the client there is no bomb. 57. The new nurse on the psychiatric unit tells the charge nurse, I don't like how the shift report is given. Which statement is the charge nurse's best response? 1. Since you are new, I think you should try it our way before making any comments. 2. We have been doing the shift report this way since I started working here more than 5 years ago. 3. Have you discussed your concerns about the shift report with the other nurses? 4. I would be happy to listen to any ideas you have on how to give the shift report. 58. The client on the psychiatric unit tells the nurse, I am so bored. I hate just sitting on the unit doing nothing. Which intervention should the nurse implement? 1. Explain that with time the client will be able to go to the activity area. 2. Allow the client to vent feelings of being bored on the unit. 3. Notify the psychiatric recreational therapist about the client's concerns. 4. Tell the client that there is nothing that can be done about being bored. 59. The head nurse in a psychiatric unit in the county emergency department is assigning clients to the staff nurses. Which client should be assigned to the most experienced nurse? 1. The client who is crying and upset because she was raped. 2. The client diagnosed with bipolar disorder who is agitated. 3. The client who was found wandering the streets in a daze. 4. The client diagnosed with schizophrenia who is hallucinating. 60. The client diagnosed with anorexia is refusing to eat and is less than 20% of ideal body weight, IBW, for her height and structure. The client has not eaten anything since admission 2 days ago. Which action should the nurse implement? 1. Notify the psychiatrist to request a court order to feed the client. 2. Take no action because the client has the right to refuse treatment. 3. Discharge the client because she is not complying with the treatment. 4. Physically restrain the client and insert a nasogastric tube for feeding. 61. The client on a psychiatric involuntary admission is threatening to run away from the unit. Which intervention should the nurse implement first? 1. Notify the police department of the client's threats. 2. Place the unit on high alert for unauthorized departure. 3. Talk to the client about the threat of running away. 4. Have the client sign out against medical advice, AMA. 62. The nurse answers the client's phone in the lobby area and the person asks, may I speak to Mr. Jones? Which action should the nurse implement? 1. Ask the caller who is asking for Mr. Jones. 2. Tell the caller Mr. Jones cannot have phone calls. 3. Request the caller to give the access code for information. 4. Find Mr. Jones and tell him he has a phone call. 63. The client seeing the psychiatric nurse in the mental health clinic tells the nurse, if I tell you something very important, will you promise not to tell anyone? Which statement is the nurse's best response? 1. I promise I will not tell anyone if you don't want me to. 2. If it affects your care I will have to tell someone who can help. 3. If you don't want me to tell anyone, then please don't tell me. 4. Why do you not want me to tell anyone if it is so important? Chapter 13 Mental Health Management 371 Question 64. Which situation would warrant immediate intervention by the charge nurse on the psychiatric unit after receiving the AM shift report? 1. The client diagnosed with paranoid schizophrenia who is delusional. 2. The PM shift licensed practical nurse, LPN, called in to say he or she would not be able to work today. 3. The male mental health worker, MHW, reports losing his unit key and identification card. 4. The unit secretary has HCP's orders that need to be co-signed. 65. The client enters a mental health clinic with a gun and is threatening to kill the nurse who told his wife to leave him. Which action should the nurse implement first? 1. Instruct a staff member to call the local police department. 2. Evacuate the clients and staff to a safe and secure place. 3. Encourage the client to talk about his feelings of anger. 4. Calmly and firmly ask the man to put the gun down on the floor. 66. The charge nurse of the psychiatric unit is making assignments. Which clients should be assigned to the medical surgical nurse who is working in the psychiatric unit for the day? Select all that apply. 1. The client diagnosed with depression who has attempted suicide 4 times and now is refusing to go to therapy. 2. The client diagnosed with bipolar disease who has diabetes and requires blood glucose monitoring. 3. The female client diagnosed with dissociative identity disorder, DID, who is complaining that she is being falsely imprisoned. 4. The client diagnosed with schizophrenia who is blocking the screen of the television and refuses to move so other clients can watch the television. 5. The client diagnosed with major depression who started taking antidepressant medication 2 days ago and who wants to remain in bed. 67. The outpatient clinic psychiatric nurse is preparing to assist the healthcare provider to perform electroconvulsive therapy. Rank in order of performance the nursing interventions to be implemented. 1. Attach the electrodes to the client. 2. Check the client's name and date of birth against the chart/orders. 3. Start an intravenous line and run at a keep open rate. 4. Determine that the client has not eaten or had any liquids since midnight. 5. Notify the healthcare provider to begin the procedure. 372 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam 68. The psychiatric nurse is reviewing client lab values. Which of the following data requires immediate intervention by the nurse? Client A. Chapter 13 Mental Health Management 373 Questions. Client, AN. Allergies, none. Diagnosis, bipolar disease. Medical records number, 123,456. Laboratory test. Client value normal value lithium level 1.20.5 to 1.3 milliequivalent/L. Client, DC. Allergies, Dilantin. Diagnosis, mania. Medical records number, 109,875. Laboratory test. Client value normal value valproic acid level 9840 to 100 mcg/L. Client, JM. Allergies, NKDA. Diagnosis, schizophrenia. Medical records number, 245,689. Laboratory test. Client value normal value white blood cell count 2.685.0 to 10.0, 103, Client, SR. Allergies, penicillin. Diagnosis, acute psychosis. Medical records number, 874,521. Laboratory test. Client value normal value potassium 4.684.5 to 5.5 milliequivalent/L. Sodium 139 135 to 150 milliequivalent/L. Chloride 102.96 to 106 milliequivalent/L. 1. Client A. 2. Client B. 3. Client C. 4. Client D. Client B. Client C. Client D. 69. The charge nurse responds to an emergency situation on the psychiatric unit in which the male client is angry, yelling, and attempting to hit other clients and the staff. Which interventions should the nurse implement? Select all that apply. 1. Notify the operator to initiate a call for emergency responders to assist. 2. Tell the client to sit down and be quiet or he will lose privileges. 3. Have the mental health worker escort the other clients to their rooms. 4. Make sure that the staff speaks loudly and directly to the client. 5. Request the unit secretary to stand by the locked doors to allow emergency responders on the unit. 374 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam Chapter 13 Mental Health Management 375 Questions Abnormal Involuntary Movement Scale, AIMS, Adapted PT Initials, _____________ Gender, ___________ Date, interviewer, movement ratings, circle 1, 0. Equals none 1 equals minimal, may be extreme of normal 2 equals mild 3 equals moderate 4 equals severe Note, number 10 0 equals no awareness 1 equals aware, no distress 2 equals aware, mild distress 3 equals aware, moderate distress 4 equals aware, severe distress facial and oral movements extremity movements trunk movements global judgments dent. AL status 1. Muscles of facial expression, example movement of forehead, eyebrows, periorbital area, cheeks, include frowning, blinking, smiling, grimacing. 2. Lips and perioral area, example puckering, pouting, smacking. 3. Jaw, example biting, clenching, chewing, mouth opening, lateral movement. 4. Tongue, rate only increase in movement both in and out of mouth, not inability to sustain movement. 5. Upper body, arms, wrists, hands, fingers, example. Include choreic movements rapid, objectively purposeless, irregular, spontaneous, athetoid movements slow irregular, complex, serpentine. Do not include tremor, repetitive, regular, and rhythmic. 6. Lower body, legs, knees, ankles, toes, example. Lateral knee movement, foot tapping, and heel dropping, foot squirming, inversion and eversion of foot. 7. Neck, shoulders, hips. 8. Severity of abnormal movements 9. Incapacitation due to abnormal movements 10. Client's awareness of abnormal movements rate only client's report. See note above. 11. Current problem with teeth and / or dentures 12. Does client usually wear dentures? Score 0 1 2 3 4 0 1 2 3 4 0 1 2 3 4 0 1 2 3 4 0 1 2 3 4 0 1 2 3 4 0 1 2 3 4 0 1 2 3 4 0 1 2 3 4 0 1 2 3 4 Yes equals 1 No equals 0 Yes equals 1 No equals 0 70. The psychiatric nurse is assessing the abnormal involuntary movement scale, AIMS, for clients on antipsychotic medications. Which client's scores require immediate intervention? 1. The client who scored a 6 on the scale. 2. The client who scored a 10 on the scale. 3. The client who scored a 15 on the scale. 4. The client who scored a 24 on the scale. 376 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam. Mr. Allen is the nurse manager in an outpatient mental health clinic. Mr. Allen has 2 RNs, Ms. Belinda and Ms. Marguerite, along with 2 LVNs, Mr. Benjamin and Ms. Jan, and 2 mental health workers, MHWs, who are unlicensed assistive personnel in the psychiatric arena, Ms. Mary Beth and Ms. Brenda. There are 2 receptionists at the front desk. 1. Mr. Allen is triaging and returning phone calls. Which client should Mr. Allen call first? 1. The client diagnosed with a narcissistic personality disorder who needs to see the psychiatrist today. 2. The client with schizophrenia who is hearing voices telling him to hurt his wife. 3. The client with major depression who is refusing to get out of bed and go to work. 4. The client with bipolar disorder who is manic and has sold the family car for cash. 2. Ms. Belinda is working in at the triage desk. Which client should Ms. Belinda intervene with first? 1. The client who had a baby 2 months ago and thinks she has postpartum depression. 2. The client who told the receptionist he wants to kill himself and has a gun in the car. 3. The woman who thinks her mother has Alzheimer's disease because her mother is confused. 4. The client who has been washing his hands in the bathroom for almost 20 minutes. 3. Mr. Allen is reviewing laboratory data for clients seen in the clinic. Which of the following client data warrants notifying the psychiatric healthcare provider? 1. The client on lithium, escalith, whose serum lithium level is 2.0 milliequivalent/L. 2. The client on clozapine, clozaril, whose white blood cell count is 10,000. 3. The client on alprazolam, Xanax, whose potassium level is 3.7 milliequivalent/L. 4. The client on divalproex sodium, Depakote, who has a Depakote serum level of 60 g/ml. 4. Mr. Allen is working in the mental health clinic and returns a telephone call to a male client who says that voices are telling me to hurt myself, now. Which intervention should Mr. Allen implement first? 1. Call 911 and tell the paramedics the client is a danger to himself and/or others. 2. Ask the client if he has taken his medication this morning. 3. Notify the healthcare provider of the client's statement. 4. Keep the client on the telephone to discuss the voices he is hearing. 5. The client diagnosed with a panic attack disorder in the clinic waiting room becomes anxious, starts to hyperventilate and tremble, and is diaphoretic. After removing the client from the day room, which intervention should Ms. Marguerite implement next? 1. Administer the benzodiazepine alprazolam, Xanax. 2. Allow the client to verbalize feelings of anxiety. 3. Encourage the client to take slow, deep breaths. 4. Instruct MHW to obtain the client's pulse oximetry reading. 6. Which client would be most appropriate for Mr. Allen to assign to Mr. Benjamin, the LPN, in the psychiatric clinic? 1. The client diagnosed with dementia who is confused and disoriented. 2. The client with schizophrenia who is experiencing extrapyramidal side effects. 3. The client diagnosed with bipolar disorder who is pacing up and down the hallway. 4. The client with anorexia nervosa who is hypotensive and complaining of dizziness. Mental Health Clinical Scenario Chapter 13 Mental Health Management 377 Clinical Scenario 7. Which task is inappropriate for Mr. Allen to delegate to the MHW? 1. Instruct the MHW to observe the client who is exhibiting compulsive behavior. 2. Ask the MHW to stay in the waiting room and watch the clients. 3. Tell the MHW to sit with the client who reports being suicidal. 4. Request the MHW to draw blood for a serum lithium level. 8. The client diagnosed with paranoid schizophrenia is yelling, talking to himself, and blocking the view of the television. The other clients in the waiting room are becoming angry. Which action should Mr. Allen implement first? 1. Place the client in a quiet room. 2. Escort the other clients from the day room. 3. Request the receptionist to call 911. 4. Approach the client calmly along with Mr. Benjamin. 9. Mr. Allen observes Ms. Brenda, the MHW, arguing with a client in the waiting room. Mr. Allen requests Ms. Brenda to go to his office immediately. Which action should Mr. Allen implement first? 1. Ask the client what caused the argument. 2. Discuss the behavior with Ms. Brenda. 3. Document Ms. Brenda's behavior in writing. 4. Terminate Ms. Brenda immediately. 10. Ms. Belinda has been late to work 3 times in the last week. Mr. Allen talks to Ms. Belinda and finds out Ms. Belinda has to take the bus to work until her car is fixed, which should be completed in 1 week. Which action should Mr. Allen implement? 1. Ask Ms. Marguerite to give Ms. Brenda a ride to work until the car is fixed. 2. Document the behavior in writing and place in Ms. Brenda's file. 3. Tell Ms. Belinda if she is late again she will be placed on administrative leave. 4. Do not take any action at this time since Ms. Belinda has an excellent attendance record. The correct answer number and rationale for why it is the correct answer are given in boldface type. Rationales for why the other possible answer options are incorrect also are given, but they are not in boldface type. 1. The client with a histrionic personality has excessive emotionality and seeks attention. Her saying something important must be understood within this context and would not warrant calling this client first. 2. The nurse should contact this client first because the client realizes the voices are telling him to hurt his mother. The nurse should inform this client to come to the clinic immediately, and he should be admitted to a psychiatric unit. 3. Because the wife called the clinic, the client is being watched and should be safe from killing himself. The nurse should call this client immediately but not before a client who made the phone call himself and who may be alone and hearing voices. 4. The nurse should expect the client who is manic not to be sleeping, therefore, this is expected behavior. The nurse should call this client immediately but not before the client who is hearing voices telling him to hurt his mother. Content, mental health, category of health alteration, mental health, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis 2. 1. Oppositional defiant disorder consists of a pattern of uncooperative, defiant, and hostile behavior toward authority figures. Not following the MHW's directions would be expected behavior in a child diagnosed with this disorder and would not require immediate intervention by the nurse. 2. Refusal to talk and/or make eye contact is a sign of autism, the best known of the pervasive developmental disorders, therefore, this client would not require immediate intervention by the nurse. 3. The child with conduct disorder is aggressive to people and animals, bullies and threatens others, destroys property, and sets fires. Throwing furniture could endanger the child or other clients. This behavior warrants immediate intervention. 4. Eating dirt and sand is pica, or the ingestion of non-nutritive substances such as paint, hair, cloth, leaves, sand, clay, or soil. It is commonly seen in mentally retarded children, but it is not life-threatening unless a medical complication such as a bowel obstruction, infection, or a toxic condition, example lead poisoning, occurs. This behavior would not require immediate intervention. Content, mental health, category of health alteration, mental health, integrated processes, nursing process, analysis, client needs, psychosocial integrity, cognitive level, synthesis. Making nursing decisions. When deciding which client to assess first, the test taker should determine WHE. The signs/symptoms the client is exhibiting are normal for the client's situation. After eliminating the expected options, the test taker should determine which situation is more life-threatening. 3.1. The nurse should discuss how the visit went, but it is not the first intervention. 2. The nurse should make sure the client took his medications during the weekend pass, but it is not the first intervention. 3. The client should discuss how the visit went, but it is not the first intervention. 4. The nurse's first intervention should be to ensure the client's safety by checking to make sure the client has no sharps or dangerous objects that he could use to hurt himself, since he is diagnosed with major depression. Content, mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 4. 1. The nurse must document the client's behavior that prompted the need for seclusion, but it is not the first intervention. 2. The day room area should be cleaned up, but it is not the nurse's first intervention. 3. The use of restraints and seclusion requires an HCP's order every 24 hours. The nurse must obtain this order first after placing the client in the seclusion room. The nurse can place the client in seclusion for the safety of the client/staff/other clients, but the nurse must then immediately obtain a HCP's order. 4. The charge nurse should make sure the other clients are not injured, but the first intervention is to put the client who is acting out into seclusion, safely and legally. Answers and rationales. 378 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam Chapter 13 Mental Health Management. 379 Content, Mental Health, Category of Health Alteration, Mental Health, Integrated Processes, Nursing Process, Implementation, Client Needs, Safe and Effective Care Environment, Safety and Infection Control, Cognitive Level, Application 5. 1. The client may or may not want the police notified, but this is not the triage nurse's first intervention. The triage nurse should first care for the client. 2. The sane nurse is a nurse who is specialized in caring for clients who have been raped. The sane nurse is able to spend time with the client, is knowledgeable of legal issues, and would be an appropriate intervention, but it is not the triage nurse's first intervention. 3. The triage nurse's first intervention is to address the client's physiological needs, which means to assess for any type of trauma or injury. 4. The client can complete the admission form while in the room. The triage nurse's first intervention should be to care for the client, not paperwork. Content, Mental Health, Category of Health Alteration, Mental Health, Integrated Processes, Nursing Process, Implementation, Client Needs, Physiological Integrity, Physiological Adaptation, Cognitive Level, Application. Making nursing decisions, when the question asks which intervention to implement first, the test taker should determine whether any of the options concern the physiological needs of the client and then apply Maslow's hierarchy of needs to find the correct answer. Remember, physiological needs take priority over all other needs. 6.1. The client with agoraphobia is afraid to leave the house, therefore, canceling a clinic appointment would be expected of this client. The nurse would not need to return this client's phone call first. 2. The client with a somatoform disorder has physical symptoms without a physiological cause. Therefore, complaining of numbness in the legs is expected behavior. The nurse would not need to return this client's phone call first. 3. The client with hypochondriasis is preoccupied with the fear that one has or will get a serious disease. Fearing breast cancer is then expected behavior. The nurse would not need to return this client's phone call first. 4. Post-traumatic stress disorder is an illness that occurs to someone who has experienced a traumatic event. The client feels a numbing of general responsiveness but has outbursts of anger. The nurse should return this call first and assess the situation to determine whether the client should be seen in the clinic. Content, Mental Health, Category of Health Alteration, Mental Health, Integrated Processes, Nursing Process, Assessment, Client Needs, Safe and Effective Care Environment, Safety and Infection Control, Cognitive Level, Analysis. Making nursing decisions, when deciding which client to assess. First, the test taker should determine whether the signs/symptoms the client is exhibiting are normal or expected for the client's situation. After eliminating the expected options, the test taker should determine which situation is more life-threatening. 7.1. The client who is depressed would be expected to look dejected, therefore, the nurse would not need to assess this client first. 2. This client who says he wants to go to heaven to be with his wife may be suicidal and should be assessed first to see whether he has a plan. 3. This client needs to be assessed for anorexia but not before a client who may be suicidal. 4. The nurse should not interrupt a client who is acting compulsively. The nurse should wait until the client finishes the behavior before talking to the client. Content, Mental Health, Category of Health Alteration, Mental Health, Integrated Processes, Nursing Process, Implementation, Client Needs, Psychosocial Integrity, Cognitive Level, Application 8. 1. The nurse needs to remove the man from the room so that the nurse can talk to the client and discuss probable abuse. Taking the client to the X-ray department may not arouse suspicion in the man and may allow the client to discuss the situation. 2. This may be needed, but it is not the first intervention. This action may cause the man to get angrier in the emergency department, or it may cause more problems for the woman if she goes home with him. 3. The nurse could demand the man leave the room, but this action may cause the man's anger to escalate. Therefore, the first intervention is to remove the client from the room. 4. The nurse should not allow the man to see the nurse discussing a woman's shelter with the client or providing a client with a brochure. This could cause further anger in the man, especially if the woman goes home with the man. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application answers 9. 1. The therapeutic serum level for lithium is 0.6 to 1.5 milliequivalent/L. Because the client's 1.0 milliequivalent/L level is within normal limits, the charge nurse would not need to notify the psychiatric HCP. 2. The WBC count is elevated, which may indicate that the client is experiencing a granulocytosis, a life-threatening complication of clozapine. This laboratory data would warrant notifying the psychiatric health care provider. 3. The client's serum potassium level is within normal limits. Therefore, this laboratory information does not warrant notifying the psychiatric health care provider. 4. This glucose level is slightly elevated but would not warrant notifying the psychiatric health care provider. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, evaluation, client needs, safe and effective care environment, management of care, cognitive level, synthesis 10. 1. This is an appropriate medication for an anxiety attack, but it will take at least 15 to 30 minutes for the medication to treat the physiological signs/symptoms. Therefore, this is not the first intervention. 2. The nurse should discuss the panic attack and what prompted it, but it is not the nurse's first intervention. 3. The first intervention is to remove the client from the busy day room to a quiet area to help decrease the anxiety attack. 4. The client's vital signs should be taken, but this is not the nurse's first intervention. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application 11. 1. The nurse should assess the client's anxiety level but not prior to ruling out a physiological reason for the client's complaints. 2. The nurse should first determine if the client's vital signs are abnormal, which rules out any physiological reason for the client's complaints. 3. The nurse should discuss techniques to address increased anxiety level, but a physiological cause of these symptoms should be ruled out first. 4. The client's HCP will need to be notified if the complaints are secondary to a physiological reason, but would not if the vital signs are within normal limits. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. If the question asks the nurse, which intervent ion to implement first, then the test taker should apply the nursing process. The psychiatric nurse must first assess to determine if the client has a physiological problem. Since option A and B are assessment interventions, then the test taker should select physiological assessment over psychosocial assessment. 12.1. The nurse should assess the client's weight, but it is not a priority over assessing laboratory values, which may be life-threatening, especially potassium level. 2. The client's laboratory values are priority because these reflect long-term effects of anorexia and possible life-threatening values that must be corrected immediately, especially potassium. 3. This is an appropriate intervention, but physiological needs are priority over problem solving. 4. A teaching intervention is not priority over a physiological need. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. When a question asks, which intervention should the nurse implement first, the test taker should use the nursing process to determine the correct answer. If the client is not in distress, then the nurse should assess. If two options address assessment, select the intervention that addresses a life-threatening complication. 13.1. This client needs to be assessed but not prior to the client with chest discomfort. If the client exhibited signs of alcohol withdrawal, then this client would have a physiological need. 2. Cocaine causes vasoconstriction of the coronary arteries and can lead to life-threatening cardiovascular problems, therefore, this client should be seen first. 3. The client who is performing compulsive behavior should not be interrupted but be allowed to finish the behavior. 4. This client is not exhibiting physiological complications, therefore, this client should not be assessed first. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, assessment, client needs, physiological. 380 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam Chapter 13 Mental Health Management. 381 Integrity, Reduction of risk potential, cognitive level, analysis making nursing decisions. The test taker should first determine if the signs/symptoms are normal or expected for the client's situation. If there are two or more clients exhibiting unexpected signs/symptoms, then select the client who is exhibiting life-threatening signs/symptoms, needs more assessment, or would warrant notifying the healthcare provider. 14.1. If the nurse does not establish the foundation for a trusting nurse/client relationship, then the nurse will not be effective in caring for this client. This is the first nursing intervention. 2. Medication is a vital part of the treatment for schizophrenia, but on the initial visit a trusting relationship is priority. 3. Support systems are an important part of the client's treatment in the community, but the client must be able to trust the nurse when sharing information. 4. Ventilating feelings about disease, his or her situation, and life is vital to the treatment of a client with schizophrenia, but the client must be able to trust the nurse when sharing feelings. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. In mental health nursing, the foundation for all nursing care is having a trusting nurse/client relationship. All the options are possible or plausible for the nurse to implement, but there is only one correct answer. 15.1. The psychiatric nurse should address the client's feelings, not the feelings of family members. 2. This comment does not address the client's feelings, and the nurse should not talk about what the doctor believes or doesn't believe. 3. The nurse must first calm the client, assess the situation, and ensure a therapeutic nurse/client relationship. This response addresses all these issues. 4. This response will more than likely further antagonize the client and is not a therapeutic response. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application making nursing decisions. The psychiatric nurse's responsibility is to de-escalate the client's GER. Being empathetic and allowing the client to verbalize feelings is the nurse's priority intervention. 16.1. Providing phone numbers for the client and family is an intervention that the nurse should discuss with the client and would not warrant intervention by the clinical manager. 2. Follow-up appointments are important for the client after being discharged from a psychiatric facility, therefore, this instruction would not warrant intervention by the clinical manager. 3. The client should be given a 7-day supply of antidepressants because safety of the client is priority. As antidepressant medications become more effective, the client is at a higher risk for suicide, therefore, the nurse should ensure that the client cannot take an overdose of medication. This instruction warrants intervention by the clinical manager. 4. The client should not take any OTC medications without talking to the HCP or pharmacist. This instruction would not warrant intervention by the clinical manager. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, analysis, client needs, physiological integrity, physiological adaptation, cognitive level, synthesis 17. 1. The client diagnosed with dementia would be expected to have confusion and disorientation, therefore, the LPN could be assigned this client. This client is not experiencing any potentially life-threatening complication of dementia. 2. The client is experiencing tardive dyskinesia, a potentially life-threatening complication of antipsychotic medication. An experienced RN should be assigned to this client. 3. The therapeutic serum level for lithium is 0.6 to 1.5 milliequivalent/L. The client's level is toxic, and an experienced RN should care for the client. 4. This client is experiencing a potentially life-threatening complication of alcohol withdrawal. An experienced RN should be assigned to this client. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis answers. Making nursing decisions, the test taker must determine which client is the most stable, which makes this an accept question. 3 clients are either unstable or have potentially life-threatening conditions. 18.1. Clients are allowed, encouraged, and expected to participate in the multidisciplinary team meeting. This is an appropriate task to delegate to the MHW. 2. One of the MHW's primary responsibilities is to watch clients in the day room area. This is an appropriate task to delegate. 3. The MHW can remain with a client who is on one-to-one suicide watch. This is an appropriate nursing task to delegate. 4. The MHW does not draw blood, and this would be an inappropriate task to delegate. The laboratory technician draws the client's blood work. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 19. 1. Telling the client to place the letter in the mailbox is empowering the client to take responsibility. This action would not warrant intervention by the nurse. 2. The nurse should explain to the MHW that mental health clients retain all of the civil rights afforded to all persons, except the right to leave the hospital in the case of involuntary commitments. The client has the right to mail and receive letters. 3. Mailing the client's letter is an appropriate action to take, therefore, this would not warrant intervention by the nurse. 4. Reporting the client mailed a letter to his family at the team meeting may or may not be pertinent to the client's care, but this action would not warrant intervention by the nurse. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, comprehension 20. 1. Whenever the nurse is given information that indicates a complication or is potentially life-threatening, the nurse must first assess the client. 2. The client is unstable, therefore, the nurse should not instruct the UAP to take the client's vital signs. 3. The nurse should not notify the healthcare provider before assessing the client. 4. Librium is a medication used for alcohol withdrawal, not for heroin withdrawal. Content: substance abuse, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application making nursing decisions, if the test taker wants to select NOTI. Phi the HCP as the correct answer, the test taker must examine the other 3 options. If information in any of the other options is data the HCP would need to make a decision, then the test taker should eliminate the notify the HCP option. 21.1. The client with lithium toxicity is unstable, and the nurse should not delegate this task to an MHW. 2. Having someone stay with the client after a meal will prevent the client from inducing vomiting and could be delegated to an MHW. The client diagnosed with bulimia needs someone there to prevent vomiting, which is a sign of this mental health problem. 3. The nurse should not delegate teaching. Helping the client with anger management would be the responsibility of the nurse or possibly the therapy department. 4. The client has a right to talk to his mother on the phone without someone listening. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis. 22. 1. The RN should be assigned to update the individualized care plans. 2. The MHWs should be assigned to watch the clients in the day area. 3. The LPN scope of practice allows the administration of medication. This is an appropriate assignment. 4. The LPNs can transcribe an HCP's orders, but the unit secretary can also transcribe orders, which the RN/LPN can co-sign. This would not be the most appropriate assignment for the LPNs. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis. 23. 1. All psychiatric staff members are taught how to take down a client physically if the client is a danger to him or herself or to others. The nurse should assist the MHW in subduing the client so that no one is injured. 382 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam Chapter 13 Mental Health Management. 383-2. The psychiatric staff members are trained to deal with clients who are angry and aggressive. There is no need to contact hospital security. 3. The nurse can document the occurrence, but because the nurse observed the takedown, the nurse should assist the MHW. The psychiatric staff members have to be able to depend on each other no matter what the situation. 4. The nurse can have other staff members remove clients from the day room area. The psychiatric nurse should help the MHW with the takedown. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application. 24. 1. The nurse should address the behavior with the clients and not delegate this task to the MHW. This inappropriate behavior needs further investigation to determine whether it is consensual or under duress. 2. The inappropriate behavior should be addressed immediately with both clients. 3. If the behavior does not stop, one of the clients may need to be transferred to another unit, but this is not the appropriate action at this time. 4. The nurse needs to talk to the clients to determine whether the kissing was consensual or under duress. Either way, the behavior is inappropriate, and the clients should be told there is no kissing or sexual activity allowed between clients while they are hospitalized on the psychiatric unit. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application 25. 1. The MHW could walk with the client who is agitated. This may help decrease the client's agitation and anxiety. 2. The nurse should not assign a task that is the responsibility of another staff member. The housekeeping or custodial department should be assigned to clean the floor. 3. The MHW cannot take or transcribe phone orders from a HCP. This must be done by a licensed nurse. 4. The nurse cannot delegate teaching to an MHW. The nurse should explain seizure precautions to staff members. Content, management of care, category of health alteration, mental health, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions, the nurse cannot delegate assessment, evaluation, teaching, administering medications, or the care of an unstable client to a UAP. 26.1. This is an example of battery, which is the touching of a client without consent. 2. This is an example of false imprisonment, which is the deliberate and unauthorized confinement of a person within fixed limits by the use of verbal or physical means. 3. This is an appropriate action by the MHW, which would not require immediate intervention. 4. This is an example of assault, which is an act that results in a person's genuine fear and apprehension that he or she will be touched without consent. Content, mental health, category of health alteration, mental health, integrated processes, nursing process, analysis, client needs, safe and effective care environment, safety and infection control, cognitive level, comprehension making nursing decisions, the nurse is responsible to ensure all clients' legal rights are maintained, even when on a locked psychiatric unit. 27.1. When an individual is declared incompetent in a court, a guardian makes decisions for the client. The client loses the right to refuse medication. 2. Unless a mental health court orders the client to receive medication, the LVN cannot force the client to take the medication. This client voluntarily admitted herself to the unit. 3. Unless a mental health court orders the client to receive the medication, the LPN cannot force a client to take it, even if the client was involuntarily admitted to the unit. 4. Charges pending in court do not remove the client's rights to refuse to take medication. Content, legal, category of health alteration, mental health, integrated processes, nursing process, planning, client needs, safe and effective care environment, safety and infection control, cognitive level, synthesis making nursing decisions, the charge nurse must be knowledgeable of client's rights in the mental health, nursing arena. The two options addressing a court of law should be included as possible correct options since the word force is in the stem of the question. Answers 28. 1. The more experienced psychiatric nurse should be assigned a client who is actively hallucinating and delusional. 2. The client who is aggressive should be assigned to a more experienced psychiatric nurse since this is a safety issue. 3. The client who is chronically depressed should be assigned to the surgical nurse who is being floated to the psychiatric unit. The client is not identified as suicidal in the option. 4. The client with a cluster B personality disorder, antisocial, is manipulative and tends to split staff, so this client should be assigned to a more experienced psychiatric nurse. Content, mental health, category of health alteration, mental health, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions, the test taker should select the client who is most stable and would require the least amount of psychiatric nursing knowledge. The primary concern on the psychiatric unit is safety to the client and others, on which client assignments must be based. 29.1. A client on a one-to-one watch must not be left alone for any reason and the MHW should be within arm's length at all times. 2. The client should not be allowed steal utensils while on suicide watch, so plastic utensils are appropriate. 3. As long as the client is with a member of the staff, the client can attend group therapy. 4. The MHW should be beside the client, within arm's length, not observing the client from the porch. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions, the nurse is responsible for supervision. NG any task delegated to an MHW, who is an unlicensed assistive personnel in mental health nursing. 31. The MHW can assist the client with activities of daily living. 2. The MHW worker is a vital part of the mental health team and is included in team meetings to discuss the client's psychiatric care. 3. The MHW cannot administer medication, therefore, this comment warrants intervention. 4. The MHW should stay in the day room to maintain safety for the clients, so this comment does not warrant intervention. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. The MHW is an unlicensed assistive personnel. The nurse cannot delegate assessment, teaching, evaluation, medication administration, or an unstable client to a UAP. 31.1. Lorazepam is used to prevent delirium tremens, and an elevated pulse would not warrant questioning the administration of this medication. 2. Methadone is prescribed to prevent withdrawal symptoms from heroin addiction, and an increased respiratory rate would not warrant questioning the administration of this medication. 3. Clonidine is administered primarily to treat hypertension but is also used to reduce the symptoms of withdrawal from opioids, nicotine, and alcohol. The nurse would question administering this medication because of the client's low blood pressure, no matter why it is being prescribed. 4. Thiamine is used to diminish Wernicke-Korsakoff encephalopathy, which is characterized by confusion, memory loss, and loss of cranial nerve function resulting from chronic alcohol abuse. The nurse would not question giving this medication to a client with Wernicke-Korsakoff syndrome, and a subnormal temperature would not warrant questioning administering this medication. Content: substance abuse, category of health alteration, drug administration, integrated processes, nursing process, assessment, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis. 32. 1. This is not correct information. Therefore, the nurse should not praise the MHW. 2. The psychiatric nurse should not correct the MHW in front of the client because it will compromise the MHW's authority with the client. 3. The nurse should explain to the MHW that the mental health client retains all of the civil rights afforded to all persons, except the right to leave the hospital in the case of involuntary commitments. The client may have phone calls restricted if that is included in the care plan for 384 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam Chapter 13 Mental Health Management 385 Example, if the client is calling and threatening the president. 4. This situation does not need to be discussed at the weekly team meeting. The psychiatric nurse can discuss this on a one-on-one basis with the MHW. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application. 33. 1. The client has a chemical imbalance in the brain, and a firm voice will not be effective in getting the client to sit down. The client cannot sit still. 2. This is the medication of choice, but it takes up to 3 weeks to become therapeutic. Therefore, this intervention would not help the nurse complete the admission assessment. 3. Walking or pacing with the client will allow the client to work off energy and may decrease restlessness and agitation. The nurse should implement this intervention to obtain information for the admission assessment. 4. The nurse must obtain an admission assessment, therefore, the nurse should walk and pace with the client while attempting to obtain the priority admission assessment. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis 34. 1. Evaluating the effectiveness of a client's medication is primarily the role of the psychiatric nurse, psychologist, and psychiatrist, not the social worker. 2. The recreational therapist helps the client to balance work and play in his or her life and provides activities that promote constructive use of leisure or unstructured time. 3. The vocational therapist helps the client with job seeking or job retention skills as well as with the pursuit of further education if needed and desired. 4. According to the NSCBN Referrals Area Content on the NCLEX-RN Registered Test Blueprint, the psychiatric social worker may conduct therapy and often has the primary responsibility for working with families, for community support, and for referrals. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application 35. 1. The first intervention should be to talk to the client and remove him from the day room to the least restrictive environment. Restraining the client is the most restrictive environment. 2. The nurse should first attempt to talk to the client and remove the client from the day room area, not try to remove all the other clients. 3. The client will probably need a PRN medication to calm the behavior, but it is not the nurse's first intervention. An intramuscular medication takes at least 30 minutes to become effective. 4. The first intervention is to approach the client calmly and attempt to remove him from the day room. Staff members should not approach the agitated client alone, but should be accompanied by other personnel. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 36. 1. This child has been abused, and until Child Protective Services has been notified, the nurse should not share any information with the child's father. 2. The Health Insurance Portability and Accountability Act, HIPAA, considers parents the personal representative of the minor child with the right to information. However, there are exceptions to this rule, including when the provider reasonably believes that the minor may be a victim of abuse or neglect by the parents/guardians. This statement is the nurse's best response. 3. Because the mother is accusing the father of the abuse, this is not an appropriate response. 4. The social worker must adhere to HIPAA regulations, therefore, referring the father to the social worker will not help the father find out how his son is doing. Content: child health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, comprehension. Making nursing decisions, the nurse is responsible for knowing and complying with local, state, and federal standards of care. 37(1), 3, and 5 are correct. 1. A no-suicide contract is one of the first interventions the nurse implements with the client. It states that if the client feels answers suicidal, he or she will talk to someone and will not take action on the thoughts. 2. This is the most stringent form of supervision in which one staff person per shift is assigned to be no greater than 1 arm's length away from the client. This would be implemented in an inpatient psychiatric unit, not an outpatient clinic. 3. The nurse should ask the client whether she has a plan. The more the specific the plan is, the more seriously the statement should be taken. 4. The nurse cannot commit to a psychiatric unit every client with thoughts of killing him or herself. The nurse must assess the lethality, the absolute possibility, and the available support systems prior to committing a client to the psychiatric unit. After the nurse requests an emergency commitment, the client must be evaluated by a psychiatrist. 5. The nurse should assess the client's support system and the type of help each person or group can give the client, such as hotlines, church groups, and self-help groups, as well as family members. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, analysis 38. 1. This client should be instructed to go to the anger management class, but this does not warrant immediate intervention. 2. The mental health worker, MHW, could escort the client outside to smoke, but this does not warrant immediate intervention by the nurse. 3. This client who is nauseated and has vomited has a physiological problem that should be assessed by the nurse immediately. This client warrants immediate intervention. 4. A client who has her menses, or period, may experience abdominal cramping and would need to be assessed, but not before the client who has vomited twice. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis 39. 1. Because the clinical manager wants to reward the unit for no absences or tardies, the manager must reward all shifts, so providing a thank you meal to all shifts would be most appropriate. This allows all the staff members to celebrate the unit accomplishment. 2. A thank you note is a nice action, but knowing the clinical manager took the time to arrange for the meal means a lot to staff members. The meal could encourage the staff to try and do the same the next month. 3. Individually telling the staff job well done is a possible action to take, but for the clinical manager to take the time to arrange for the meal on all shifts is above and beyond just saying thank you to each individual staff member. 4. Having no absences or tardies for 1 month for an individual employee is the expected behavior. The fact the entire unit had no absences/tardies is what is being acknowledged. Content: management, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 40. 1. The nurse must take action to protect the wife. 2. The statement can be documented, but this is not the appropriate action for the nurse to implement. 3. Mental health clinicians have a duty to warn identifiable third parties of threats made by a person even if these threats were discussed during a therapy session. Tarasoff v. Regents of the University of California, 1976. The nurse should notify the client's psychiatric HCP so that the wife can be notified of the threat. 4. The nurse should not encourage this behavior because it could cause serious harm to the wife. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application 41. 3 and 4 are correct. 1. Exercise often causes the client to have trouble sleeping. This intervention is not appropriate. 2. Elopement precautions are implemented for clients who are at risk for leaving the facility, therefore, this is not appropriate. 3. Caffeinated beverages are stimulants. Therefore, this is an appropriate intervention. 4. An alarm on the bed would help ensure safety for the client because the nurse will know immediately when the client leaves the bed. 5. Watches known as 1-to-1 are for clients who are suicidal. Therefore, this is not an appropriate intervention. 386 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam Chapter 13 Mental Health Management 387 Content, Mental Health, Category of Health Alteration, Mental Health, Integrated Processes, Nursing Process, Implementation, Client Needs, Safe and Effective Care Environment. And, Management of Care, Cognitive Level, Analysis Making Nursing Decisions. The test taker must select one or more interventions for select all that apply questions. The test taker should read each option and determine if it is an appropriate intervention. 42. Correct answer, 3, 4, 2, 5, 1 3. Denial. 4 anger. 2 bargaining. 5 depression. 1 acceptance. Content, Mental Health, Category of Health Alteration, Mental Health, Integrated Processes, Caring, Client Needs, Psychosocial Integrity, Cognitive Level, Comprehension Making Nursing Decisions. This is a knowledge-based question, but the test taker must remember many facts that must be applied when taking the NCLEX-RN registered examination. This information is the basis for many questions addressing the grieving process. The nurse must know these in the correct order, and the appropriate interventions for each stage of grief. 43.1. Identifying strengths and weaknesses is included in the orientation phase. 2. Identifying problem-solving techniques is part of the working phase. 3. Evaluating the client's experience is part of the termination phase. 4. Establishing the rules for the meetings is part of the orientation phase. Content, Mental Health, Category of Health Alteration, Mental Health, Integrated Processes, Caring, Client Needs, Psychosocial Integrity, Cognitive Level, Comprehension Making Nursing Decisions. If the test taker is not familiar with the phases of group dynamics, then the word middle why give the test taker an idea of what may be the goals of this part of group dynamics. Evaluation is usually done at the end. 44.1. On the inpatient psychiatric unit, the priority is maintaining safety for the clients and staff. 2. Contacting family members is not priority over safety. 3. Safety is priority over a client who is exhibiting behavior common to an inpatient psychiatric unit. 4. This client needs to be assessed, but not eating for 2 days is not a safety issue for the inpatient psychiatric unit. Content, Mental Health, Category of Health Alteration, Mental Health, Integrated Processes, Nursing Process, Implementation, Client Needs, Safe and Effective Care Environment, Safety and Infection Control, Cognitive Level, Synthesis Making Nursing Decisions. When answering questions in mental health nursing, the test taker should identify safety as a priority intervention in any situation. All of these situations require intervention, but safety is priority. 45.1 and 3 are correct. 1. Each member of AA has a sponsor who has successfully quit drinking and is a support to a new member trying to stop drinking. 2. AA does not discuss medications used to help prevent drinking alcohol. 3. AA is a support group made up of recovering alcoholics who help others to stop drinking based on the 12-step approach. 4. AA helps an alcoholic realize he/she is helpless over his or her addiction. He/she has no power over the addiction. 5. Recovering alcoholics speak at the meetings, not professional guest speakers. Content, Substance Abuse, Category of Health Alteration, Mental Health, Integrated Processes, Nursing Process, Implementation, Client Needs, Health Promotion and Maintenance, Cognitive Level, Comprehension Making Nursing Decisions. Select all that apply questions require the test taker to select more than one option. The test taker must select all correct options to get the question correct. This is an alternate type of question on the NCLEX-RN registered. 46.1. The nurse should determine the lithium level, but it is not the first intervention the nurse should implement. 2. The nurse should assess the behavior that prompted the admission, but this is not the first intervention. 3. The nurse should first assess the client's physiological needs because the client in the manic state may not have slept, bathed, or had anything to eat for days. The client's physiological needs are priority. 4. Lithium takes 2 to 3 weeks to become therapeutic, therefore, a stat dose of lithium orally will not help the client's manic state. This is not the nurse's first intervention. Answers. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application 47. 1. A democratic manager is people-oriented and emphasizes efficient group functioning. The environment is open and communication flows both ways, which includes having meetings to discuss concerns. 2. This statement is that of an autocratic manager who uses an authoritarian approach to direct the activities of others. 3. This statement is that of a laissez-faire manager who maintains a permissive climate with little direction or control. Instructing the staff to handle the situation on their own does not support the staff. 4. This statement is taking control of the situation, therefore, this is not a statement indicating a laissez-faire manager. Content: management, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, comprehension 48. 1. Unless the client is anorexic and there is a court order, the nurse cannot force-feed a client. 2. This is client abuse, and the charge nurse must investigate the allegation immediately with the nurse. If the allegations are true, they should be documented in writing and reported to the Client Abuse Committee. 3. The charge nurse should not ask the client about the situation first. The nurse and MHW should be involved in the investigation of the allegation. Then, if needed, the client can be asked about the situation. 4. The charge nurse should investigate the allegations first and then, if needed, have the MHW write down the situation. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 49. 1, 2, and 5 are correct. 1. The nurse should assess the client for any injury, side effects of medication, and general well-being every 2 to 4 hours. 2. As soon as possible, the nurse must inform the client of what behavior will allow the client to be released from the seclusion room. 3. According to the Joint Commission Restraint and Seclusion Standards for Behavioral Health, the client's family is notified promptly of the initiation of restraint or seclusion. 4. The nurse's goal is to release the client as soon as possible from the seclusion room. When the client has calmed down and is able to verbalize feelings and concerns in a rational manner, the client should be released. The seclusion order must be renewed every 24 hours, but the client should not be kept for 24 hours unless absolutely necessary. 5. Clients must be checked at least every 10 to 15 minutes in person and may be continuously monitored on video cameras. Content: mental health, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application 50. 1. The nurse should first separate the MHW from the client, therefore, asking the MHW to go to the nurse's station would be the first intervention. 2. The nurse should not correct the MHW in front of the client and should not use the word arguing. Therefore, this would not be an appropriate action. 3. The psychiatric nurse should handle this situation immediately. If this is a pattern of behavior of the MHW, then the clinical manager should be notified. 4. This behavior may or may not need to be reported to the Client Abuse Committee, but if the nurse overhears the MHW and client arguing, the nurse should stop the behavior. Content: management, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application 51. 1. The psychiatric social worker can refer clients, but the nurse should assess the client to see what type of help she wants. 2. The psychiatric social worker does not perform or participate in ECT treatment, therefore, this client should not be referred. 3. The nurse needs to assess the client to determine why the client is having difficulty going to work. For example, is it sedation secondary to medications? 4. The psychiatric social worker can assist with financial arrangements, referrals, and non-physiological concerns. Content: mental health, category of health alteration, mental health, integrated process.